Namaste TV Asia viewers and welcome to Ayurveda Mantra Show by Santigram Wellness Kerala Ayurveda Centers. Each and every single week we talk about benefits of Ayurveda treatments and how it can cure any disease, sickness or illness. Dr. Ambika Nair, one of the directors of Ayurveda Wellness Care Centers in the USA, shares her knowledge and experience of over 30 years in Ayurveda treatments. Dr. Nair, welcome to the show.
Hi Sanjeev. Hi TVH viewers. Really, I'm again here just to talk about whatever you are going to ask, I will talk about that.
Correct.
Today.
Again, you are here to tell us more about Ayurveda, benefits of Ayurveda treatments, like you've been doing it every single week, viewers, and hope that you are really enjoying the show while you're getting to know more about Ayurveda benefits. Dr. Nair, I want to talk about prenatal care in today's episode. As you know, natal care is very, very important in order to avoid any problem later in a pregnancy. What is a natal care?
First of all, the parents has to come for age. It should not be too old or too young also. Like a 16-year-old and like a 20-year-old, like when they conceive, like the boy 19-year-old and the 16-year-old means, so mental maturity is not there, The child can get into like ADHD and like mental problems, so that is also there. So like 22, 23 like that, they are okay. And the boy will be like 27, 28. So they come to me.
That's a very mature age.
Little mature age, and they know what they are doing. And they also think that now it should not be an accident. It should be a planned pregnancy.
There's a difference between that, right?
Very, very different, because accident, oh, hamara aise hi ho gaya. We never wanted that actually.
And they are not happy with that child because hamesha aise hi kahenge कि we didn't plan, but tum aise aa gaye.
Like aa gaya, fir kya kar sakte hai? We even tried for abortion, it did not happen. So many times, and in front of the child also they talk sometimes like that. It's very, very dangerous.
So number one thing is that it must be planned.
It must be planned, and both should be very willfully coming for conception. As if they are going to the temple, take the blessings. It should be like that. Okay. It has to be blessed. Then only it will work. Okay. So both the parents will have, like the person, the husband and wife think that we should have a child now. Okay. Then they come. When they come, so we will see them, diagnose them, whether they have any ailments which are not like showing explicitly on them, or whether they are, for the lady, whether her menstruation cycle is okay. If not, then we have to treat for that. Then any other ailments what she is suffering, like any inflammation in the pelvic area, any hormonal imbalances, any like a PCOS, like a polycystic ovarian disease, any mental issues like a depression or anything like that, any arthritis, any previous history of any other treatments what she has taken, any accidents, anything like that. Okay.
Wow.
Yeah, so that is more important, because see, if the land is not fertile, you cannot like put a seed over there to grow, and you cannot expect a good child to be born, not a good crop.
True.
So the boy also should be like healthy. We always say that they should be healthy, not only just looking healthy, mentally and physically. They are like we have to make them understand that you are going to accept a newcomer in the family. For that, what you need is that, because you have to prepare your mind and body. Okay, so that is more important. Okay, then not to give, okay. Then we do the Vajikarana Chikitsa also for the men, and even maybe some people need only like a few days of treatment. Sometimes very bad infertility means, then we do them in a this is antenatal, means it is entirely different.
Okay.
This antenatal means the really willfully who comes to that Ayurvedic doctor for advising how to go for a conception.
Achha.
Yes.
Wow.
Okay, so this is very good. Okay, then we tell them when to meet, how to go with that, and it should be it's not like after drinking or anything the conception, because it is a divine intervention. Okay, so how it has to be done, how it has to be, what timing, everything we explain them.
Okay.
Okay. And it should be with so much respect, and the area, the room also has to be with a, like a very good smell of the scent or any incense sticks or something, and it should be in a very pleasant situation, and no tension, no anxiety, nothing, no fight, no pressure from any sides, because you are going to make the world, because this child will be ruling the world next.
Correct.
Yeah.
I mean, obviously, you're going to be welcoming, a member in your family.
Absolutely.
Your responsibilities are going to be more and more.
Yes.
And obviously, whatever you think and whatever you do, it's also going to affect child's
Yes.
birth
Yes.
and then a child's future also.
Yes.
Anyway, viewers, you're watching Ayurveda Mantra Show. We're going to talk more on this pre and postnatal care after the break. Welcome back to the Ayurveda Mantra Show. In this episode, we are talking about pre and postnatal care with Dr. Ambika Nair of Santigram Kerala Wellness Ayurveda Centers in the USA. Dr. Nair, before the break, we talked about basically prenatal care.
Yeah.
All right. What is the process? How does the treatment works and the medicine and everything?
Okay. Once, like after the detoxifications, we tell them, like they will be conceiving. So from the every month, we give them, because see, the first month we'll be giving so that they don't get any constipation, they don't get any acidity, anything like that. They don't get any other chronic infection,
Okay.
because their immunity will be less also at that
Correct.
time, so that, once, because they are taking some life, one life inside. So that is more important. And like ultimate care has to be given. This we always make the husband and the family members aware. Don't give any tension, don't trouble her unnecessarily, because whatever, see, your son's child, because that should be an asset in your family. Not a problem, like otherwise you will be roaming from hospitals to hospitals.
Okay.
And this autism, everything, like we always tell that first you treat for the cause, then only you conceive.
Okay.
Okay. Then second month the blood formation will be there, At that time we tell them to take a pomegranate, and there are, like a little bit of amla. There are so many things, but not to take so much of sweets, because so much of sweets means it can be pre-eclamptic toxemia, diabetic can be there.
Right.
And not only that, if they eat a lot of sweets and all, the child itself will become, like the brain development will not be there a lot. Yeah.
Okay.
So manasika, they will not be that great. Their concentration, everything, because we see a lot of children, like it should have been avoided, but maybe ignorance, like about Ayurveda or the natural things, how to get it done.
Correct. Now,
Okay.
when the couple comes to Santigram Kerala Ayurveda Wellness Center, prenatal care that I'm talking about, right? And this is before conceiving and everything. At what stage that they should come? A couple of weeks before they start planning, a month before, or?
They come like, it's not like that. Sometimes they come like 3 months before.
Gee.
And like, some people will have issues. Understand?
Okay.
So they will not conceive then and there.
Correct.
So we have to make it, like even a thyroid case means, then they go for the blood work, they'll come back and tell that the thyroid is okay. Even after conception also they will do. Sometimes it takes 6 months, according to the case it is. Whether it is kapha related, whether it is pitta related, vada related. You understand? Okay. So accordingly, then we have to balance them. Then only they will get a very, very intelligent, good child. Yes.
Okay. And then when they come to you, during that process, they can continue to go to their gynaec?
They will always go to their obstetrician.
Okay.
Yeah. And normally they say that we don't take any medication or anything like that. But they go for all those things.
Okay.
Yeah.
What is postnatal care?
Postnatal, okay, then so the prasuti, the delivery happened.
Gee.
You understand? It is a very big trauma for we prepare during the antenatal itself, we will be preparing them mentally and physically. That's why the diet is more important for the lady. Okay. So, like you will get so much of pain, we will tell them, but it's so easy because the motherhood is not a small thing.
No, true.
Because you are carrying the responsibility. The father gives, he sowed the seeds.
Exactly.
Okay, the mother has to carry it. So like she needs more concern. Like so that's why people help and see. Naturally, the husbands will help them because in this country, not every family member is there. So they help a lot. And eating good food, right food at the right time, that according to constitution we always give.
Correct.
And mentally preparing them for the delivery. Okay, because what medicines they should take after, because what is delivery? Delivery itself is a vata, because that's why the vata only pushes through the womb, you understand? So it is a natural delivery. Okay. Then like the body will be very weak, so they should be given, like we give them turmeric, we give them ghee preparations, and there are certain like Dhanvantari Arishtam is there, so that they don't get any vata.
Oh, so
like
all this complete desi stuff.
Absolutely, everything.
Okay.
And even everything is desi. There is nothing like that. Dhanvantara Gulika, so that they don't get any issues. Like you see, normally after the deliveries, some people get a manasika vifrandi, like how to take care. The child is there. So we pacify them and we make them understand before itself how you should care the child, how you should give the milk to the child, what is the importance of breastfeeding, everything we tell them.
Okay.
Yeah.
So now let's talk about a treatment. What kind of exactly Ayurveda treatment given to this pregnant lady? As you mentioned, a lady when she's pregnant, she goes through a lot, right?
Okay.
So what exactly the kind of treatment that Santigram Ayurveda Wellness Center gives it to pregnant lady?
Like pregnant ladies, like at that time, if they need only, some people are very anxious. If they don't come, if they prepared and come before, means they will have no anxiety, understand? No? Some people are like with the work and all, because here everybody works. So, like tension means then we give them to pacify their vata, they don't sleep, that we take care in that. Sometimes Shirodhara and light abhyangam, on the body. Not any hard massage or during the pregnancy. Okay, then comes, after the delivery, what we do is that we always there are certain other therapies, because the back and everything we give them very special therapies that I'll tell them.
Okay, all right. When we come back after these messages, we're going to talk more on pre and postnatal care in this Ayurveda Mantra show. Welcome back to the Ayurveda Mantra show. In this episode, we are talking about pre and postnatal care. As you know, that during pregnancy, or not only during pregnancy, but before, during, and after pregnancy, certain cares very, very important for mother and the child to be born, or child which is already born. And that's what we are talking about it right here in this episode. Dr. Ambika Nair is actually sharing a lot of her knowledge and experience when it comes to Ayurveda in this show. Dr. Nair, tell us about, we learned about treatment, but tell us about food and the diet, what they should follow, and why is it so important to eat certain desi food?
Yeah, okay, I'll tell. See, they can see the first month, that we will, I told you, the fruits and all what we give, like a pomegranate, amla, they can take, like even pumpkins and all, because it is rich with the, like zinc and calcium, and banana they can take. They can take all the vegetables. See, they should eat every vegetable. Okay, like not only sour means they only eat sour. No, it should not be that, because then the acidity will be more. You understand?
So they should.
They should always
need to balance
mix
it
and
out.
balance everything.
Correct.
Yeah, to balance. Even not only that, even they can take. Like even before conception also we tell the same things. Like what the lady should eat. Like they can take. What the black gram, then like they fry and take it with the ghee, so that their dhadus will increase, you understand? And even during the pregnancy also, they should not take a lot of spice. Sodium should be, like salt should be in the proper way, not so much, okay? and not so much of sweets. Nothing should be excess.
Okay.
And they should not overexert. They should not lift any very heavy weight and
That's
all.
what I was going to ask you next. What about exercise?
Yeah.
Following a diet is one thing, getting treatment is another thing. What about exercise?
Okay, the diet again, they should eat in the proper timings.
Gee.
They should not eat in between unnecessarily, because that will create a lot of, see what, what one will digest, they should eat only that, okay. And they can eat like even 5-6 meals also.
But they also get a lot of urge during that
No,
time
that
to eat
pica
more.
pregnancy is there, that they can eat it, but some things they don't like it, but still, that we should give, so that, everything should be mixed, even though they vomit, let them vomit, because you should not stop your natural urges, like some people, they are in a show or something like that, like working or something, they will stop their urination and they will hold it for a long time. This is all very bad on their part. Okay, then like coughing, anything, even like vomiting sensations, they should not stop it, because this is all the natural urges which will otherwise affect the fetus.
Correct.
Exercise concern, they can go for a mild walk, light exercises like not forward bending anyway, only like light exercises like a little breathing with anilom vilom, not that very badly. Okay, they can go for morning, like a little walks. They can do all the household works. It is not a disease. It is an enjoyable time, pregnancy. Some people, they take advantage by telling, oh, I cannot move, I cannot. But there are certain times, when you have an incompetent cervix and all, then like repeated abortions, we get a lot of clients like that, habitual abortion. Then we tell them, like you have to lie down. Yeah. And even such cases also comes to me with the complications, like a habitual abortion, like they had like a 6, 7, 8 abortions. Then even the Shirodka stitches, that where it failed, then we have become successful. Yeah.
Correct.
Even
now,
with us.
there could be a possibility that not too many people are interested in getting this pre and postnatal
Absolutely,
care.
yeah.
What would you tell them? How would you convince them to get this?
It's not a must that everybody should be. See, that is another important question, We don't tell them, everybody may not need the panchakarma or anything, you understand? No? So when they come, like in the consultation itself, that some herbs, what they can do at home. See, everything starts from the kitchen itself. What you eat, it more, everything depends upon that, okay? And with what tension you use it. With so much of anger, everything, if you work, means the child will be like that mood. And you will be the sufferer. So we make them understand. Please don't be jealous unnecessarily, like unnecessarily competitions with the other people, like they have this, like jealousy, so much of, unwanted thoughts, I should say. This all like, that's what, like we make them understand and we really convince them to calm down. And some people, they take the medication, 99% they take the medication also. Herbal medications which help for a very, very healthy child without any complications.
Nice.
Yeah.
Good.
Yeah.
Now, having understood what you said about prenatal care, postnatal care, and the benefits of it, right? A question comes to my mind is that once a child is born, is there anything related to Ayurveda? I mean, do you think that newly born baby should have some Ayurveda treatment also?
Yeah, only the massages.
Only the massages.
Yeah, see, because already, it's a very interesting question. Already the father and the mother came to me. Okay, so I did all the care for them.
That's why it came to my mind.
So the child, the zygote, what they brought, whether it is kapha father or pitta mother, so the combination will be there. Okay,
absolutely.
so with the treatments and with that, it is a very, very good child without any doshas. Okay, this is all the gift from the God. Okay, okay. So that child, so they will come and show the child, have a look. Even 2 days child, they come to me.
Wow.
They tell that, like, because actually atopic eczema is very common.
Okay.
So anything like that, we tell them no. Because at that time, they'll be breastfeeding the child. So we tell the mother what to take. Some days they may take, like unnecessarily things, so many antibiotics or anything like that. So we tell them not to take such things. And, like the food has to be, because you have to see what the child needs. So this we educate the mother, actually. And not like so much of drinking cold water, not very hot water, about what they should take bath, how to take bath, and even the therapies after the delivery, we have very good therapies also, like which make the person to go back in the same original shape before the conception.
Arre, wow, really?
Yeah. So that's why we all look like this.
And that's why that's what Santigram Wellness Ayurveda Well Center is all about. But it's really interesting that even a newborn baby could have this Ayurveda massage.
Yeah, we do the Ayurveda massage.
Fresh herbs and a different
we
oil.
tell them, we teach them also how to go with that. Some people, they will tell that, okay, we bring for a few days. Okay, so we teach them how to do it also. They do at home also.
So
Very interesting it is, very interesting.
In the end, Dr. Nair, if you can, share any information on this prenatal, postnatal, maternity care in case if we missed out on anything.
Okay. The viewers, I'm going to tell you people, if you all need any help before conception, please come to me. Please come. You are free to talk to me. You can just come and ask me what I should do. Anything I can do to bring a good child in your family, I will definitely do it for you. Please don't be hesitant. Be open to me. You are welcome to Shantigram anytime. Because you should understand, we are not here to make any like complicated cases, like the children. The children, what you opt, it should be beneficial for the country, beneficial for the human being. Okay, so we should always think that we should get a good child with the blessings of God. Okay, even though whether you believe it or not, but there is somebody that is called nature. Okay, nature's blessings are always important in our life.
Well, I couldn't agree with you more, Dr. Nair. Very well said. Well, viewers, in this episode, again, we learned something more on Ayurveda and how beneficial Ayurveda treatment is, even for a lady who's pregnant, prenatal, postnatal, and during pregnancy, how it can help to have a healthy baby, and also once baby is born, baby could also have a healthy Ayurveda massage. And that's what this show, Ayurveda Mantra, is all about. Please send in your questions, anything that you need to know about Ayurveda at info@tvasiausa.com. That's our email ID, and we will welcome any question on Ayurveda, and we'll definitely talk about it in our show. Dr. Nair, thank you so much once again for giving a lot of information on Ayurveda.
Thanks a lot, Sanjeev, and I would really love to help anybody who comes to me.
Exactly. And this is once again Ayurveda Mantra Show by Santigram Wellness Kerala Ayurvedic Centers in the USA. Thank you so much for watching it, and we'll be back next week with more information on Ayurveda treatments. So long and take care.